9:10 is the time here on a Thursday morning. You know, your doctor is not the only person who determines what care you get. Your health insurance company has a say because they either approve or deny paying for treatment that your doctor has recommended.
So this process, it's called prior authorization. I'm sure a lot of you have dealt with this. And as of March 31st, insurers are required to publicly report their approval and denial rates. This is under a new federal rule. Health insurers have complied, but that data is not that easy to find.
So we sent our shark, our KSTP Health and Medical Expert, Dr. Archelle Georgiou, to find it, to dig into the numbers, tell us what this all means. She joins us here this morning. Hello.
I love that introduction. You're shark.
You were like, this happened on the 31st, and we're going to get to the bottom of
You
this.
bet.
So what are you finding numbers-wise?
Well, in the state of Minnesota and across the country, there's huge variation in the approval and denial rates across health plans. What I did was I analyzed the publicly available data for Medica, for the Blues, and for Health Partners, which are, of course, the big payers here in town, and we can see some degree of variation. For Medica and Health Partners, they have a 13% denial rate. So that's about 1 in 8 people who have care recommended by their doctor. They're initially being told, nope, we won't pay for it. You can have it, but your insurance isn't going to pay for it. The Blues, about half of that, at about 7%. So you can see how much variation is. And these are reflective of the ranges that we've seen nationally. Now, I do want to point out what this data reflects. Health plans were only obligated to report this data for insurance that you buy off the insurance exchange, as well as,
so
that's what this represents.
It's not private.
True,
insurance.
But I've analyzed data across plans, and this is consistent.
Okay,
Their
pretty
processes
accurate.
are the same,
Yeah.
so I just want to point out this is for MNsure plan, exchange plans, but it reflects what you're likely to experience across your employer-sponsored plan or even your private insurance.
Can you sort of walk through why pre-authorization exists in the first place and what it is?
Absolutely. So prior authorization started many years back, decades back, as a way to make sure that people were getting the best care and the most conservative care first, as opposed to jumping to the most aggressive.
Rushing to having XYZ.
Absolutely.
Yep.
And when you do that, there's cost savings associated with that. So the problem is it's gotten out of control. The process is laborious and bureaucratic, and it's creating delays in care. But let me give you an example of how it works. Let's say that you wake up and you have excruciating back pain. You may deal with it for a few days, it doesn't get better. You go to your doctor, maybe an orthopedic surgeon, and they say, you have a lot of pain. Let's see what's going on, and you get an MRI. But maybe only about you've had the pain for 2 weeks. If they put in a prior authorization request for that MRI, the insurance company, in most cases, will say, nope, not medically necessary, because their criteria are that you have pain for 6 weeks before you have the MRI.
Okay.
And so that is the sort of decision. That's not completely unreasonable, because most back pain does go away in less than 6 weeks, so you wouldn't have needed the MRI. But that's how the process works.
And are they looking for you to take other steps before you get to the MRI, over-the-counter medicine, see a chiropractor, physical therapy, some of the things that maybe cost less?
Absolutely, including physical therapy.
Okay. So when a request is denied, do we know why? I mean, are the insurance companies obligated to explain why to the patient their claim has been denied?
They are obligated to tell you that it's why it's been denied, and they're obligated to tell you what portion of the contract it is not consistent with. So let's go back to that MRI.
Yeah.
They're obligated to send you a letter that says that it's being denied for medical necessity, and you're entitled to a letter, which most people don't get or ask for. I don't know what the laws are in terms of telling you exactly what part of the guideline you didn't meet. I don't think that they're obligated to tell you that part, but that is what they are looking at.
How long do they have to do that, to tell you what the situation is?
So we're finally getting some standardization around that. So for a standard request, they have 7 calendar days.
Okay.
And for an urgent request, they have 72 hours. But let's just put that into perspective. 7 calendar days, okay, maybe you can wait a few more days to get the MRI. Let's just keep sticking with that example. That's only if your doctor submitted every single data point and detail that they need to even review that. So if they didn't get the initial x-ray of your back that was just done in their office, they'll say, we didn't get enough information, you have to resubmit. So that 7 days for many people turns into multiple weeks and delays in care. And so over 90% of physicians, when they were surveyed by the American Medical Association, say that this process is out of control. 93% say it's causing delays in care and impacting the quality of care for patients.
So what do you do as a patient? I mean, let's say you're the one with the back pain and you've been suffering for several weeks now, and your doctor says, let's figure out what's wrong, and you get this denial back. What rights do you have as a patient to go, no, wait a minute, we need to do more with this. I want to dispute this.
I think we all need to step back and say, well, should I delay it? Fair question to ask.
Sure.
Is there something else better that I could do? Often you really need or want that service, that procedure. And the most important thing you can hear from this segment is to appeal it. You have appeal rights. We know from data nationwide that only 10 to 11% of denials get appealed. But of those that do get appealed, the majority get approved.
You're kidding.
Yes, yes. And if you don't appeal it, the denial stands, you don't get your service, and the profit goes to the bottom line of the health insurance company. And you can see the overturn rates by the payers in the state.
What does the appeal, what's the process?
What's
what do you
that
have
look
to
like?
do?
It is a little laborious, not too hard. Anybody can do it. But here's what I would say. Make sure you yourself have that denial in writing. Often your doctor will get it, ask for it, have it in writing, because you have to have the contractual language to help you out. 2, look online to see what your insurer's criteria are. You may not be able to find them, but you can just generally, most insurers have the same criteria. Then what you want to do is attach your medical records, write an appeal letter, send it to the insurance company. Here's the most important thing. Keep track of the timelines on their response, because once again, they're obligated to get back to you in a certain period of time. If they don't, they may need to approve it just because sort of you got them on an administrative timeline.
Like snail mail the letter to them or email them?
I would always put it through a portal if you can.
Okay.
An email. And then sometimes you'll get that kickback, hey, we received your thing, we're reviewing it, and that would be like the first date and time to mark down.
Yes, absolutely keep track of the timelines for the initial submission as well as for the appeals.
Well, that's promising. I mean, the fact that people are being denied, one thing, but to hear that majority of them, if you are appealing them, are then overturned, I mean, that's encouraging.
Absolutely it is. And it suggests that the initial denial was probably not appropriately made anyway. And so, yeah, we're in the middle of a lot of complexity.
Indeed.
Yes.
Love me some health
But
insurance.
Megan, the squeaky wheel does get the grease, it sounds like.
Well, I'll keep you posted.
You keep squeaking.
We're going
find
to talk
out.
about this after the segment.
Thank you, Archelle. If you would like more medical news and how medical news impacts you in your life, make sure that you check out Dr. Georgiou's podcast. It's called Speak Up for Your Health. We'll be sure to post a link to episodes on our site, minnesotalive.com.